sleep, because by the time Friday gets here, we're all pretty tired. Good to see you, Dr. Nick Circolo.
It's always good seeing you.
So this is really fun for a lot of people because we don't get enough sleep, we know.
No.
Most of us, if you go so far as to think you have to have a sleep study, you get to a certain point, then you put the brakes on because nobody wants to have to go and be observed sleeping in some chamber.
Well, you know, one of the beautiful things about this is, in my field, I get to see patients more than once. So what happens is, when they come into the office, I hear little nuances about what's going on in their lives. Sometimes a wife will come in, or a husband will come in with his wife, and they'll go, "Did you tell him about your sleeping? Can you do something for his snoring? Can you adjust something to get rid of that snoring?" And what we find is that they haven't gone any further with this. They haven't gone to see a sleep doctor. So what we did, we partnered with a group that does a home sleep study test. And it's this sleep study. What you do is they send it to you. You sleep with this. It has a cannula for your nose. It has a pulse ox to check your oxygen level. And it has a heart rate monitor. It monitors everything overnight. You take it the next day, you put it in a box, you send it out, it goes to fellowship sleep doctors. They read all of this and make recommendations. Do you need a CPAP, or do you need a mandibular appliance, which a dentist makes to help you stop snoring?
So you are very quick to say that you're not a sleep doctor.
No.
But are you using this ability then to kind of be a conduit for people to help them learn what's going on with their health?
Absolutely.
And then they're empowered to take the next step?
Exactly. You know, what we do is, if I tell you, oh, go get a sleep study, well, you know, 80% of the people, when they make an appointment for a sleep study, they don't keep it. You know,
because nobody wants to go and be observed. I would not.
I can't sleep well in a strange place. I like my own bed. I like my own environment. You know, so if I can get somebody to take this home, use it, if we find that something's wrong, then their whole life changes. You know, we have diabetes, heart disease, weight gain, libido changes, hormonal change, all associated with sleep apnea.
Let's talk about that a little bit. I think you gave me some stats that said something like 80 million of us snore.
Oh, yeah.
So that's a pervasive problem that most of us deal with. But the sleep apnea is something totally different. And it's a problem, why? Because it's really obstructing the oxygen flow, and that's what causes then the other health issues?
What you have is you have events. So if somebody has sleep apnea, they'll stop breathing. What'll happen is, in the back and throat, it'll close itself off, and you'll be startled and wake you up. Well, this event that keeps happening ends up becoming more serious as time goes on, and what we want to do is preempt that and stop that. Now, a lot of people snore, and it may have this snoring which is keeping them up. They're not getting enough sleep. Now, they can use a mandibular appliance, where it's basically it looks like a mouthpiece that they put in and keeps their mouth from getting into a certain position so they don't snore, so they get better sleep, more oxygen into the body.
It's kind of the chicken and egg, you know, which came first, the chicken or the egg? And I guess we don't totally know what causes some people to have sleep apnea versus others, but the fact that then what follows, it becomes this circular effect with your health. You mentioned some things rather quickly. Let's go back and touch on them.
Sure.
Diabetes can be triggered, I guess, type 2.
Part of it can be associated with sleep apnea.
Because why? If you're not getting correct sleep, your metabolism tends to slow down?
When you look at sleep apnea, not only is your metabolism slowing down, but it changes the hormones in your body. So your body's not using what's known as homeostasis. You're not able to regulate the body normally.
Okay, so is it something that we tend to see as we age, or can it affect anybody?
It can affect anybody. I mean, I've seen, you know, you've seen little kids snoring or having some sleep apnea events. What's really funny is I don't have sleep apnea, okay? I don't snore at all, ever. I've never heard myself.
You're a perfect human being.
Exactly. I've never heard myself snore. Now, you ask my wife that question.
You've never heard yourself. Okay, I got it.
You ask my wife that question, totally different. That's what we hear a lot of. You know, I don't snore, Doc.
Okay, but there's this test that people will take.
Right.
It has a name.
It's the Alice Night 1.
Okay.
And what it is all it is a little unit that takes in and finds out what's going on with your body, and it saves it and stores it in this unit. Then they take it back to a center. They look over what's going on and let you know how many events you've had, if you are having sleep apnea, or if you're just snoring and not getting enough oxygen.
But there's also a survey that they'll take that kind of asks you.
Yeah, there's the Berlin survey, which is kind of the general test that you take.
So for some people who are watching, and maybe your spouse is with you saying, "See, I told you you snore." There's a difference in snoring, though, and the snoring with sleep apnea. This is really really loud snoring, right?
Yeah, and even little snoring, any snoring at all could be leading to this or causing a problem with interfering with your sleep. Think about this. How many people do you know take energy drinks? How many people drink coffee? Oh, I'm so tired when I get up in the morning. Or at the middle of the day, you know, I'm just so tired. Well, what we have is we have problems if they're not sleeping, they're getting drowsy. So now they're getting behind vehicles,
right.
They're working at work, and some people find themselves, you know, I can't even sit in front of my computer without dozing.
But you know what else has happened, I think, is that lack of sleep is one of the biggest problems that we face right now in this
Absolutely.
country. So if everybody else is saying, yeah, I'm tired too, perhaps you don't focus in on it enough and
Exactly.
realize the other health problems that can come with it. And that's true even if you don't have sleep apnea, right? Even if you're just simply not sleeping enough.
Yeah, we really need, our lives are so busy and we are so inundated with thinking that when we go to sleep, our mind is thinking. You know, we're designed perfectly. When we go to sleep, if we have a problem, our mind is functioning to solve that problem while we're sleeping. So you've probably had it before. You go to sleep and maybe I lost something, and in the middle of the night you go, oh, that's where it is.
Sure.
It happens all the time.
Because you're finally relaxed and so your
Exactly.
mind frees up. So you had the patient who said, hey, can you help my spouse with this snoring? Can chiropractic techniques help with snoring, or is it its own separate
its own separate entity. Now, again, alignment of the body, keeping it with homeostasis, all of this has to work together. It's not just one thing that fixes it. I'm not going to be able to adjust your cervical spine. Boom, you're going to stop snoring.
Right.
Now, you'll feel more relaxed. It can relax the neck muscles, and your snoring may be less, but it's not going to take it away.
You did not intend for us to go down this path, but I'm
No.
going to take us there anyway. So, Nick, if you see him smiling more now than perhaps you used to, it's because he's a new grandfather.
Oh, my gosh.
So before he came on 3+U this morning, he got all social media friendly. This is Nicholas.
Here's my boy, yes.
How old is he now?
He's going to be 8 months next week.
Those rosy cheeks. So you use him as your propaganda tool to push your appearance today. But as young as Nicholas is at 8 months old, you can begin to be adjusted. Always important to keep your
Yes.
body in alignment, correct?
There's some really great pediatric studies done with colic and ear infections, but you always want to get the babies looked at, make sure that there's nothing else going on. I get it all the time. I know we went down this different path, not a wrong path, but a different path, that, people come into my office, and if the child has an infection and they're not giving them an antibiotic for the infection, they want to try something natural, that's great. But there are times when the baby does need an antibiotic. Mm-hmm. By getting adjusted, it helps drain that a little bit better, allowing the antibiotic to work better.
What you get at Dr. Circolone's practice is a great ear. He's a good listener, and he's going to listen for things that you might not even know you're saying that will give him some keys on how to help you get the maximum health that you deserve. Right?
I do. The best part of our office is I'm able to listen and do things because I see you more often. We have a relationship. My philosophy is if I touch you, we have to develop a relationship.
That's a fair assessment. You will find him, Dr. Nick Circolone, at Apple Physical Medicine and Rehabilitation over on Shallowford Road, just behind the Hamilton Y, 855-7376, applerehabgroup.com. Call him today, find out about this great sleep study that you can bring home to the comfort of your own bed. Thank you, Nick.
Thank you so much.
We're
It's always a
back
pleasure.
after this.